they feel better, they can go home or they can go to the ICU.
They're at max capacity, all 4 COVID units and the 2 intensive care units for COVID patients at Beaumont Hospital in Troy.
Hopefully nobody gets worse today, and we'll go from there. All right, good job, team. Thanks.
We are pulling back the curtain, going inside to see what frontliners have lived for a year now.
Extremely tired.
My low point was recent with a younger patient, 50 years old, and not making it.
It's quiet chaos, not like the TV shows. Nurses monitor some patients 24 hours by video outside of the rooms, and when they go in, it's quite a process, layers of PPE. We had to suit up, and let me tell you, it's hot, disorienting, and they do it over and over again. To most, this place is a mystery unless you've lived it.
I was thinking, am I gonna die or something like that for a minute? For a hot minute, I got scared.
4 days earlier, patient Patrick Flood was having thoughts he'd never had before.
10 feet and I'd be out of breath. Could not fill my lungs up. You take breathing for granted. I've never thought so consciously about breathing in my life, Each breath, I couldn't do it.
He was immediately admitted to a COVID unit and put on remdesivir, an antiviral medication now widely used as treatment with steroids and oxygen.
You feeling better?
Way better.
Excellent, good.
Yeah, complete 180.
Doc calls him one of the lucky ones. The treatment is working, but more days of isolation in this room before he can be reunited with his baby boy.
How hard is it being away from the little one?
Oh my God, I'm in love with the boy. So it's been tough. So I'm anxious to get done with this.
This is a war. I mean, it is. And we are the ones on the front line.
Nancy Vedelich is a head nurse working this unit since the beginning. Her daughter, a COVID nurse, too, just a floor below.
I had a patient the other day who said he still did not believe that it was a real thing.
She says the worst has been treating entire families. Some don't survive.
It's extremely draining. I mean, one day you're working and a patient is doing just fine, and the next morning you come in and they've been moved off to the ICU. It just happens so quickly, and it's so unpredictable.
Being in here, is it scary? Are you scared?
I was scared. I thought that was it for me.
Anacita Bista is a former nurse. Now she's the one in the hospital bed on oxygen. The 74-year-old had 1 dose of the vaccine when she got sick.
I have to admit, in the beginning, I was a skeptic. This COVID is real, and people should not take it lightly.
After a week in the hospital, her oxygen levels still too unstable to even think about going home, putting her health in the hands of tireless staff.
They are the superheroes. If not for them, they put their lives on the line in order to save so many people, including me.
They're scared, they're anxious. They don't know if they're gonna do well or not.
Doctors and nurses doing double duty, providing emotional support for isolated patients. Even when Dr. Chad Mansour is not working, he's working.
When we're not doing direct care, we're still getting called, we're still putting orders. It's a nonstop, it's like 24 hours.
They're at an unprecedented pace without a finish line.
The numbers are real, and it's bad.
Our visit to the unit was at the apex of this latest surge last week. Since then, Beaumont says they have seen a plateau, but finding enough space for COVID patients and the staff to take care of them is still extremely challenging. Jessica Dupnack, Fox 2 News.